All right, everybody, welcome to this week's episode on Fit as a Fiddle. Our guest today is Vignesh Doraiswamy. He is a medical doctor and internal medicine and pediatric hospitalist at Ohio State University and Nationwide Children's Hospital. And he's also an assistant professor at the Ohio State College of Medicine, where he works with medical students as a portfolio coach and applied health systems science coach, which we're really excited to hear about all of his work. So welcome to the show today, Vignesh.
So nice to have you, and so good to see you again after a very long time. And for the first time ever on any sort of show, someone pronounces my name 100% perfectly.
Well, that's because our parents are from the same town in India, and our parents are friends, and that's why you're on the show.
But still, it was perfectly done, and I don't always get to hear it that way. But thank you. That was a really kind intro.
Fantastic. Well, so obviously, Vignesh has, or Dr. Doraiswamy, sorry, he has a lot of big brains. He has been a doctor for quite some time and has been working with patients for years and years. And he also has the added experience of working throughout the COVID pandemic very, very closely in clinical care with patients. But what we're here first to talk about is his journey through medicine and what brought him here today. And then for all of you guys are like, oh, I've already heard about COVID. I don't want to hear about COVID anymore. It's still here and there are still implications for the future. And so from a medical perspective, we are going to have Dr. Doraiswamy kind of give us a little bit of insight on what's going on right now in like fall 2021, winter 2022, kind of around this New Year season, and rolling around into the rest of 2022 and implications of that. So that's our topic for today. So let's hear more about you first. Tell us about, I haven't caught up with him in a minute, so we were catching up offline and I heard a little bit about his life, but I want you to tell everybody else.
Sure. So I was born in New York. I traveled a lot. I went to elementary school in Jacksonville, Florida. Actually did middle and high school in South India. And during that time, we made a trip over to the US. And I think I met Sneha and her family when you were probably in elementary school. Because
I was definitely in elementary school. Yeah. And I was very surprised that you were playing with me. I was like, why is this guy doing playing with me in elementary school? He seems so cool. He's giving all of our little kids attention.
And then surprise, we'll get to it, but somehow pediatrics is a part of my life. So I think it makes sense. Yeah, so I did middle and high school in India, came back, did college in Miami, med school in Tampa. And then when I tried to figure out what I wanted to do in medicine, and if you've seen Scrubs or Grey's Anatomy, all these shows talk about residency, where we trained for an extended period of time, sort of like an extended apprenticeship, so to speak. And I struggled a lot. I kind of didn't want to let go of anything. I wanted to be able to take care of people of all ages. Sometimes when you see your pediatrician and then you're like 20, 21, you can't see them anymore. So I decided to do 2 residencies. And so I trained as a pediatrician and also as an internist or internal medicine. And then over the last 3 years, I've been very lucky and privileged to be a clinician educator. So I get to teach medical students, teach residents, learn from them. I learn from them every day. But at the same time, I also get to take care of patients at sort of an academic medical center. And that's what I've been doing here in Columbus. I'm a hospitalist, which is a fancy way of saying I don't have a clinic. I only take care of folks who need to get admitted to the hospital, folks who get admitted to the hospital, making sure, coordinating their care, getting them home eventually safely. We'll probably touch on that a little bit later today, but not everyone can just go straight home after they've been hospitalized. If you've ever been sick for like even a few days, you know how it knocks the wind out of you. Imagine being sick enough to be in the hospital or in the ICU for a bit. But I really like what I get to do. It's a lot of fun. Being in a clinic gave me anxiety. It's the reason why I'm not in a clinic. I have utmost respect for primary care doctors and folks who see, providers who see folks in clinic and like are able to accomplish so much in 15 to 20 minutes. It's always been really hard for me. So I love that I get to dictate how much time I spend with my patients. I get to see them multiple times a day. If I so, desire, I get to, sit with their families and talk with them a bit more. I know it's not for everyone. There are lots of people who think what I do is insane. But it's been, a really great and rewarding job. And so I'm really glad that I get to do it.
And we're really happy that you're in it because we need you guys. I know personally as a outpatient physical therapist that I did work in acute care for a little while. I was in ICUs and NICUs, and it's definitely a world of its own. It's very, very different in terms of how you practice your work and how you implement the tools that you've learned in school and your clinical care. So yes, it's great work that you guys do. Keep doing it.
I'm right back at you. I can't do outpatient world. I don't know how folks do it. The utmost respect for how you're able to to pull all that off. Quick story, I tore my ACL, my MCL, both menisci a little over a year ago, had surgery. I still very actively go to physical therapy, going from like twice a week to once a week. And like more than a year out, I'm finally, my injury was so bad, I'm finally allowed to like start jogging and doing like plyometrics and that sort of stuff. Would not have gotten there without my own DPT, who has seen me like, honestly, she's seen me more than any other human besides my wife in the last like year and a half, and like since the injury. But no, like they are fantastic resources. And without like our therapists, we would get very little done in the hospital, to be honest.
Oh, well, thanks so much. All right. So why don't you tell us, I guess the first thing that I want to dive into that we both discussed offline is the idea of the discharge plan. So it's kind of like, you know, when people start their businesses, they're like, we're trying to figure out our exit strategy immediately as soon as you start a business. And it's kind of sort of in hospitals where as soon as the patient is admitted, the idea is that the patient is well and leaves the hospital, right? That's at least my understanding of it. And so I'd love for you to chime in on that and what the experience is like, kind of navigating the different pathways of discharge plans and post-discharge avenues, I guess.
Yeah, the reason I kind of wanted to talk about this, I think, is very few people are even planning to be hospitalized, right? No one really thinks about it. No one's planning for, oh, I'm going to get in the hospital, let alone what happens when you get out of the hospital. And like I said, we've all been sick for a few days and you're completely winded, you're knocked out, you lose a lot of energy. Imagine being in the hospital for a few days with something that's sick enough, you know, you need oxygen, or you're getting feeding through a tube for a little bit because your stomach can't handle it, or, you know, whatever the case might be. We really get deconditioned in the hospital. And there's some folks I see who've been in the hospital for a week, 2 weeks, 3 weeks, 4 weeks. I know we're going to talk about COVID a little later, but there's some folks because of COVID have really extended hospitalizations. Even if they're, you know, young and healthy, sometimes they come out very deconditioned. I'm sure we've all seen some of the viral pictures of like elite athletes and bodybuilders who lose all their muscle mass. And the reason I bring all this up is people just assume as they get better, they're going to go back home. But there's so much that, you know, really goes into play there. I have to ask them, well, what's your home situation like? Is it a single story, 2-story? How many steps do you have to get into your home? Like, how are you going to take care of yourself? You aren't able to do even this. You're using a bedside commode in the hospital. And so that's one of those places where, you know, the acute care or inpatient therapists, physical therapists, occupational therapists, speech therapists, they help us so much. This is what they do every day. They really evaluate folks and see, where are they? And are they okay to go home? Are they safe enough to get back home? And I love that you said this, because I ask medical students this all the time, but we start thinking about discharge the moment we admit someone. If I'm not thinking about what's next, how do I know how I get there? And so we talk to patients about this pretty early on. And the answer is always the same. I don't want to go to a rehab facility. I don't want to go to a skilled nursing facility. I just want to go home. And I hear them. I mean, any time you spend in the hospital is time you don't want to be in the hospital. And the first place you want to go is home. And there's some people who refuse, and, you know, we respect their wishes. So they end up going home, and then they often come right back because they either fall or they couldn't take care of themselves, and, you know, they get sick again, or they couldn't even walk over to take their sort of meds they needed to, or the antibiotics they needed to. So yeah, it actually becomes a very complex issue. And I don't think a lot of people are thinking about it because, like I said, no one's even planning on being hospitalized. So who's actually out there thinking about, well, if I get hospitalized next year, what's my exit strategy? How do I know that I'm safe to go home? But a lot of the times it really is the best idea, even if it's a short stay. It's like basically having a personal trainer work with you 3 hours a day if you're in an inpatient rehab facility to get stronger. And the goal is always to be able to get you back to your prior level functioning, and sometimes even better. There are folks who haven't been independently functioning in years who I'll discharge to a skilled facility, call them in a month to check on them and see how they're doing, and they're doing better than they ever had before. So it's not something people think about. It's not something I thought about until I was in, you know, medical school and in the hospital. But I think it's such an important thing to know because it can really lead to better outcomes.
Yeah, I love everything that you said. And I mean, just in the short time that I was in acute care, it is like so many people that make that decision together. You know, there's different, you know, doctors, different specialties, who come in and give their advice on however the patient presented. And then the physical therapist gives their evaluation. And if there's an OT or speech or whoever comes in, and then you take in what the patients have to say. I mean, you take in what is a family situation, like you just mentioned. You know, it's very different getting somebody discharged who, you know, just finished you know, having an amputation or something that's, you know, really life altering. And then they have a 3-flight walk up, you know, and maybe they may not be ready for that. Or if there are not enough caregivers or not a caregiver, and, who can even manage their medication or manage their mobility. So I know that there's a lot that goes into consideration, and I know that it can be very tricky. And so I guess my next question is, when it came to the added layer of COVID, there's all the red tape and bureaucracy that goes on top of that, right? Because these places are packed. There's also the idea of, well, if somebody is COVID positive, can they even go to a facility? There are all these other pieces, and I don't know what that was like because I wasn't in that setting. So please tell us what is it like, and what is it like now?
I think at the beginning it was a bit challenging. We weren't really sure with a lot of things with COVID. We're still not sure with a lot of things, but if someone had tested positive, but they initially were sick and had tested positive like 3 weeks ago, are they still likely contagious? Probably not. But all the skilled facilities make sure folks are tested before they go. And if they are, because it's good for them to know for their own staff. And if they are positive, there are certain facilities that only take folks with COVID or have certain wings only for their folks who still actively have COVID. For the most part, people who are contagious end up staying in the hospital or some sort of quarantine at home until they're able to go somewhere. I'd mentioned rehab or a skilled nursing facility where you can go, but another great option is home PT. They often can't, like home health services can't provide PT to 2 hours a day, 3 hours a day. They can't see you 4 or 5 times a week like you would in a facility, but sometimes it's better than nothing. And like you said, we evaluate the home situation. So for these sort of folks, sometimes we're like, well, if you have family members who can be around like 18 hours a day and you're otherwise, relatively functioning, we can figure out a way where we get you home. We'll find someone who can come work with you. Well, that was hard during COVID. Home agencies didn't want to send their therapists for good reason to folks who may have COVID. What's gotten better is I think we just know a lot more. With every passing day, we have a lot more information. We know a lot more about when folks are actually contagious, how long the test results are actually kind of valid for. We can use your symptoms and your test results to have a better idea of when you're actually sort of, fine and not going to infect people. So we know a lot more now. I would honestly say that things are pretty much back they're at a pre-COVID level in terms of how everything is functioning for the most part, as far as getting people, out of the hospital, whether it's to home or to rehab. We've had enough time to where all these facilities and home agencies have figured out good ways to make sure that patients get the care that they need. But yeah, initially it was pretty challenging. It was new for everyone and no one really knew. And like you said, it takes a village. It's a whole team, multiple specialists. I have case managers and social workers I work with literally on an everyday basis and talk to them multiple times a day. And they really work their butts off trying to get people, a facility that meets all their requirements, that's close to home, can provide the services they need, all that sort of stuff. But thankfully, I would say that we haven't experienced necessarily that huge bottleneck of all of them being full. And again, that just goes to show that people just assume that here's what a lot of patients think. When I mention a skilled nursing facility rehab, they're like, oh, I'm going to a nursing home. But it's not quite that. It's not really like an assisted living facility. It's not like you're in a nursing home, someone takes care of you for all your needs. Their goal, their facility's goal is to get you better, get you back to those goals so you can get out of there and go home. So they're like doing their best to try to really get you back up to speed. And if they didn't, we would have bottlenecks. And the fact that we haven't really experienced a lot of that just goes to show how hard these folks are working, I think.
Absolutely. I totally hear you. And I think just knowing the way that physical therapists work, I don't know too much about all the other professions. If you're working with a PT, they're trying to get you as strong as you can possibly be, as quickly as you can be. And they're probably kicking your butt to do it. Half of our job is just motivating somebody to get up out of bed and do the work that we need to do. And this is even for people who are not so sick that they are bedbound. So can you just imagine?
Oh yeah, and you're surely right. There are folks who are bedbound, and that's who everyone thinks. But legitimately, there are people in their 20s, 30s, and 40s, it doesn't have to be as serious as amputation. It can just be, and this is a true story. I probably once a month see someone who maybe CrossFitted a little too much and comes in with rhabdomyolysis, where their muscle is breaking down because they work so hard. So these are young, healthy people who are just doing 30 deadlifts and as many reps as possible and all of that. And they're sort of just done. They're in the hospital. They're there for days to make sure their kidneys don't fail because it can cause kidney failure. They get tons and tons and tons of fluids, but then they get so weak that they need this sort of help. So everyone assumes it's just folks who are older who have all these comorbidities, but tons of young folks benefit from seeing, various therapies in the hospital too.
Absolutely. So let's shift gears to your personal experiences on the doctor side of things. And we don't have to necessarily touch base from 2020 COVID era, but really 2021 vaccines rolled out. I'm sure, like you just mentioned, with every passing day, there's a lot more information. What is the experience like for the doctor himself who is in the hospital, has to do rounds, has to do this, has to do continuing education, I'm sure. And there's just so many pieces that you have to keep up with in order to manage your patient loads and just deal with the chaos. So what was that like for you?
So I think early on, like it probably was sort of controlled chaos. Our hospital numbers, like many others, they were, this is all public information, so you could find it, but numbers were through the roof. Before the vaccine, we didn't have a lot we could do, or early on, we didn't even have like drugs that we could give people before remdesivir, before we had large studies that showed that dexamethasone works really well. And that's just a steroid that we use for other stuff, but it reduces inflammation so much that folks with COVID seem to respond really well, especially the folks that like need oxygen or are sicker. But these days, I think we have more information. We don't really have that much more we can do for you. If you're sick, a lot of it's just supportive care, give you oxygen through a variety of different means as it gets worse, all the way up to a breathing tube. There's various things that we do in the hospital. But we still give remdesivir, we still give steroids. That hasn't changed. But I think what's changed is the kind of people who are getting sick. I think initially it was a lot of folks who had a lot of comorbidities and were older. Those folks overwhelmingly seem to be vaccinated these days. I don't take care of a lot of folks who are unvaccinated and hospitalized, to be honest. And that's not some propaganda. I know there's a lot of controversy about all of that, but I legitimately have taken care of one patient who was vaccinated and had COVID in the hospital, and they were mostly fine. They were a patient who had a transplant and their immune system was weak. And the transplant docs wanted us to watch them for a little bit. The patient never needed oxygen or anything. But besides that, the only folks I see, and actually tomorrow I start another 7-day stretch on one of our COVID units, is a lot of folks. Most of them are the ones who don't have vaccines of any kind for whatever reason, and I know there's all sorts of reasons that people may want to or not want to get it, but I think the vaccines have helped a lot. I think the kind of folks who are getting sick and coming to the hospital has changed. The demographic has changed, and it's almost entirely, at least for us, folks who are unvaccinated. This is all at the adult hospital. In the children's hospital, of course, we've just started having approval for younger kids. Right. So the kids that we see with COVID tend to do, like the data says, tend to do really well. There are serious conditions like MISC or multi-system inflammatory syndrome in children that exist, and we see those too. I work at a large tertiary children's hospital, so we do get referred some of those cases to our center. And those kids can get very sick, and I think we still haven't figured out why it hits certain people really bad, or some people seem to be a little bit better. But overall, I would say, the current state of affairs is that numbers go up, numbers go down. Currently in the state of Ohio, it looks like from like today's data that our hospitalized numbers and cases are going up, whether that's because it's colder again and it's, respiratory viral season maybe, or is it relaxed, mask restrictions, or maybe vaccination numbers are falling down. I'm not sure. I'm sure it's probably all of the above and a little bit multifactorial. But right now our numbers continue to go up at the moment. But I think that hospitals are better prepared for surges now. We've had so many contingency plans upon contingency plans that I think we have a decent idea on how to deal with them. But, even as recently as just a month or so ago, there were hospitals in our region that were stopping sort of what they were calling non-urgent surgeries or elective surgeries because we sort of needed those beds as numbers were continuing to rise. But I think overall, we just know so much more now that overall we're doing a lot better. And with most hospitals having some sort of vaccine requirement for their staff, I think that's helped a lot too, because our own staff aren't getting as sick as they probably were before.
Yeah, that's really good to hear. I know it's very political, and there are a lot of things that people have to say about, masks versus no masks. And I mean, we are healthcare professionals here on this show, so we propagate science and, evidence-based.
What the evidence is. Maybe we could talk about that for a second, because we have great evidence. We didn't forever. And I know people wanted to complain about no good evidence for masking, but there was a huge study, an actual randomized controlled trial, like a cluster study they did in Bangladesh. And it showed that the groups that wore masks had much, much lower transmission rates. For the longest time, opponents of mask wearing would say, there is no good data. This is all like not real data, or like, not real kind of experimental data. We want a randomized control trial, but it exists now. It's there. And, even for the longest time, I had to agree. I had to say, it sounds more like common sense to me, and we have some good data, but you're right. I can't give you a clinical trial. But now we have one. We've had one for a while now, but there is great data and evidence to show that masks help a lot. And it's all a piece of the puzzle, right? No, I'm not trying to say that if you wear a mask, there's 100% chance that you
Of
never ever get
course.
COVID. And like, we like move our masks, we roll them down, and we eat with like, so you can still like on an airplane, right? They say, oh, you can take it down for like eating and drinking, and you're still right next to someone when you're eating. So I hear those sort of concerns, but we know that largely speaking, masks help a lot. And the evidence just say that. And the same with the vaccine. There is so much, so much evidence. I mean, between just my parents, me, and my sister, I think we have received 3 different kinds of available vaccines. And if you really think that I would have let any of my family members get something, and I personally wouldn't have gotten something that wasn't super, super safe, or I didn't look into every sort of research paper, then if I wouldn't let that happen to my family, that's how comfortable I was with them getting the vaccines. But
Yeah.
You're right, we're healthcare professionals. We got to stick to where the evidence is, because that's sort of, that's how we are trained, and that's what we base
Right.
everything we do on. So
Yeah.
I agree.
Yep. And that's how we will continue to be. And if anybody's listening who doesn't agree with that, of course, you're entitled to your opinions and your belief systems, and that's okay. But what we're doing here is just, the idea of this podcast is that we're sharing different viewpoints, and that everybody gets to hear their perspectives, and mostly hear the evidence is what I'm most interested in as well. So on that note, let's maybe shift gears a little bit on projections, because I know numbers go up, numbers go down. I know we've discussed already that hospitals are at least a little bit more equipped to move forward, but there's a lot of controversy about what's going to be happening in the new year, and how are things going to be really progressing forward. And I preface this whole thing to the audience, I myself have not done a lot of research on this topic, so I'm kind of learning as we go along as well. But from your evidence and the things that you've been reading, the literature that's out there right now, the conversations that doctors are having amongst themselves, what do you feel like 2022 kind of could look like for hospitals and life?
Yeah, I think largely speaking, it'll continue to get better. I mean, there's a semblance of quite a decent semblance of normalcy now. I mean, you can, there like professional sports are filled, giant concerts are happening, like air travel isn't really restricted, and air travel volume has pretty much gone to where it was pre-pandemic in some places. Certainly there's mask wearing, and there's some things that have changed, but I think that overall, for the most part, many things are pretty much back to normal. I'm trying to think off the top of my head if I can think of anything that like is completely still restricted. And I don't know, certain areas might be, but I think largely we are getting better and better each day. And a lot of that is, I think, because we know more about it. Masks have been pretty decent overall. Vaccines have certainly helped, I would say. I mean, there's tons and tons of data to show that the vaccines have been very beneficial in reducing the number of people who are hospitalized or how sick they get. I'm not saying it's going to prevent infection altogether or prevent transmission even, but it does help lower transmission, and it does prevent how sick you can get from being, really worse. But largely speaking, some of it is unknown. We don't know what the second winter is going to hold. There are suspicions that things could get worse. Is that why our numbers are going up ever so slightly? There's been an uptick in a lot of places now. Is it because that this is primarily a winter virus? It could be. It's hard to say. But I think, again, we're better equipped for it. And with the percentage of our population that's vaccinated, going higher and higher, I just think that things are going to continue to get better. I think 2022 overall, and I hope I'm not wrong, but I think 2022 overall will be even better than 2021 from a sort of life being back to normal standpoint.
Yay. And I know you don't have the answer to this question, so I'm asking you more your opinion, but but based on what you have been seeing, do you feel like every kind of 6 months we're going to be getting revaxxed, and that's going to be sort of a normal process that we might be going through as a society?
Maybe, maybe not. So this is sort of interesting. There is data out there that, maybe this is just a 3 vaccination series. Maybe you don't need yearly boosters like you do for influenza. I mean, influenza it's the way it changes and mutates and sort of changes the sort of like H and N segments. That's why you have like H5N1, H1N1. There's like 8 of each of them, and you can kind of make any combination you want. Not really, but kind of. It's a different way of mutating than a coronavirus like the COVID does. So we might not need to. Yeah, I know there's like another like strain of interest with Mu. I think Delta really like affected things by spreading so quickly and reducing the vaccine's effectiveness ever so slightly. Well, largely speaking, it might be something for us healthcare workers, at least. It might be one of those like boosters you get, like a combined flu COVID-19 sort of shot. It's hard to say. But overall, I mean, they're still doing studies and all of this. I'm a part of a clinical trial as like a participant where my blood's been drawn every like 3 months. And they have sort of been checking to see if I've been infected, looking at my antibody titers, comparing it with when I get the vaccine. I'm due for, like, I just got my third as a healthcare worker, like my third vaccine. So I'm going to be checked in a little bit to see, you know, what are my antibody titers and does that have anything to do with sort of how things are. It's a pretty large study and they're doing it at multiple hospitals. But I say that just sort of to say that, yeah, you're right. Some of this is opinion. I don't entirely know, but there's some data to show that this just might be a three dose series, sort of like, you know, some, you know, pneumonia vaccine or hepatitis vaccine that you get as a kid. You just get, 3 or 4 shots and you're done. Hopefully that's all this is. Part of the challenge, of course, is, you know, and I do feel a little guilty about, like, I've gotten a third shot and there are folks out there throughout the world who don't even have a first or second. And so there's certainly vaccine inequity out there. But at the same time, that dose, and I spoke to people about this in our hospital, they're like, Vig, if you don't get that dose, like, it's just going to go to waste. It's not like it's going to be transferred. It's here. It's like allocated for these people. So we want our folks to get it. But yeah, so I think that, you know, as things continue to get better, maybe in the US, we still need to get more, you know, healthcare inequity still exists very, very, very largely. And we have to be able to find a better way to really, you know, there's great, I think Gavi is the organization. There's multiple organizations out there that are trying to reduce that inequity and inequality and make sure we get the vaccines out to everyone who needs it.
I love that. I have to look that up a little bit more because we actually offered a COVID vaccine educational workshop through my nonprofit, PTIS. And the reason we started that was because there was a CNN article that came out. I live in Washington Heights in Manhattan, and that our community was not getting vaxxed. This is when they were first getting rolled out. So we reached out to some of the senior centers around our community, and we just kind of educated people on what the vaccine is. Not saying get the vaccine, but rather let's not read our Facebook messages about the vaccine, and let's rather kind of learn about it in a more practical and evidence-based way. And so we did that around our community, and I think we made like a small little tiny impact. But I hope that there are organizations you know, that are kind of doing that around the world, because there is so much misinformation and there's so much politics and there's so much money, and it's very, very complicated. I know that, you know, just reading the literature and engaging with my community here in New York, that it's a complicated topic. So, but thank you for tackling a lot of these big topics here for us today.
Oh, of course, no problem.
Is there anything else that you want to add on any of this, or really on anything else?
No, not much else. I think, you know, thanks again for like talking to me about all this. I think obviously there's tons of stuff about COVID folks talk about forever. I just thought, especially like talking to a DPT, I thought it would be a great idea to just like plant the bug in people's ears that sometimes maybe if you're being hospitalized and, you know, no one's ever planning for it, think about what our goals are. Our goals of care are always to get you back home, get you better to where you were before, or even better than before. And sometimes, you know, maybe a short stint at somewhere in between a hospital, a place to get rehab, or, you know, sort of like a bridge to get you there is often the best thing to do. Unfortunately, I see a lot of people, at least once or twice a week, I see someone who, you know, really just wanted to go home, and I hear them. So they went home, they just weren't well enough to go home, and they often come right back to the hospital. And that makes me feel pretty bad, because then our goal is to like really minimize the amount of time you spend in the hospital. And part of that is making sure you don't get re-hospitalized or readmitted. So, but yeah, I mean, it's honestly not something I was thinking of. So I don't blame anyone for not thinking about it, but I think it's such an important thing to consider. And maybe someone hears your podcast and God forbid they ever get admitted in the future, and they're like, you know what? I'm going to go get rehab for a week and then go home and be extra strong, and everything's going to be great.
I love that. Well, I'm obviously a huge proponent of getting rehab and doing PT, so I fully support your viewpoints and encourage everybody who's listening to consider that as well. I hope you don't get hospitalized ever, but God forbid.
Please don't. Do your best.
Yes. Stay strong, stay healthy, wear your mask, all that good stuff. Great. Well, thank you so much for coming on the show today. We hope to have you back in our next season as well to chat about all the new developments, because this is an ever developing topic. So I'm sure there'll be lots more to talk about then.
Of course, no, thank you so much. This was so nice. And I'd be very, very happy to come back whenever you'd like.